It's working.
We are here. Hello, hello.
Hello. Thanks for joining us on YouTube today, or if you're listening to the audio version of this podcast, wherever you are listening. Apple Podcasts, Pandora Podcasts, Google Podcasts, I don't know, all over the place.
Yep.
You can also connect with us on Facebook or Instagram. And do please consider leaving us a rating or review for this, either here on YouTube or on a streaming platform like Apple Podcasts. Any rating or review you can give us will give us some little bit of feedback on what we do and also help other people find us. So thank you for joining us today. This is the LTI podcast. We are talking about laser therapy.
Of course.
We're talking about laser therapy when it comes to utilizing it in clinic as a clinician. So this is a provider-focused podcast. However, if you're not a provider, not a healthcare provider, this could still give you some decent information if you're really interested in the field of light and laser therapy. Mm-hmm. So we're going to be going over a very new study today and talking about plantar fasciitis. Before we get going, my name is Jason Roundtree. I'm a chiropractor and a certified medical laser safety officer. I'm also the founder of LTI. This is Christy. She is a certified laser tech, and she is also the VP of our creative development, which means she builds all of our online courses and makes sure that they are working like they're supposed to so that our doctors who train with us can access the info they need continuously and get some good knowledge on
effort. The brains, and then I just make it available.
So. Well, brains is a debatable level sometimes, but the idea is what we do here is try and get information into clinicians' hands in a useful format.
Right.
How do you actually use laser in clinic to see success for your patients? At this point, we have over 6,000 studies that have been done on laser. Over 100 have already come out this year in 2024 alone. And this is one of them. So we're going to talk about using laser therapy in clinic for patients with plantar fasciitis. This study is titled Photobiomodulation Therapy plus Usual Care is Better Than Usual Care Alone for Plantar Fasciitis, a randomized controlled trial. And this was published in the IJSPT back in January of this year. It's an interesting study. It is an open access study, so if you want to read the whole thing, we'll give you the link to it. But I want to summarize it for you today and give you a little bit of insight into what I think are some benefits of this study, but also some limitations with this study. So let's talk about plantar fasciitis first. Before you go and comment or send us an email about the term plantar fasciitis, I know we're supposed to use the term plantar foot pain because plantar fasciitis is outdated now. But all of our patients know it as plantar fasciitis, and this study even gives us a little line about it. They say plantar fasciitis is the leading cause of heel pain in ambulatory settings, affecting up to about 10% of adults. Though the name is misleading, so if you're just hearing this, welcome. This is where we're going with the science of heel pain. It's not just inflammation. So what are we talking about? This plantar heel pain, foot pain, plantar fasciitis, whatever we're going to call it. Essentially, they say that repetitive trauma to the connective tissue of the plantar fascia causes acute inflammation, yes. However, it's the combination of tissue destruction, fascial thickening, collagen necrosis, matrix calcification, perifascial edema, and alterations in vascularization that lead to the debilitating pain associated with plantar fasciitis.
That's a lot.
That is a lot.
That's a lot.
So it's not just a little bit of inflammation. Otherwise, you could take an anti-inflammatory and it would go away and it'd never come back again.
But that's not the case.
That's not the case. No, we're talking about actual tissue changes. Edema around this fascia, collagen death. We're talking about significant changes. Now, a lovely tool for this is ultrasound. On ultrasound, you actually see the fiber breakdown and degradation, the thickening of the fascia itself, or the edema that can be present too. And that's why we can confidently say with something like a plantar fasciitis diagnosis, if you're looking at the soft tissues, you can see those changes. So it's not just this acute inflammatory process.
And it's not a figment of your imagination.
Right.
There is actual pain. There's cause for it.
Absolutely. Yep. You can see a lot of that on MRI too. It's just a little bit faster, easier, and of course much cheaper on diagnostic ultrasound. So if you're curious about somebody's heel pain, yes, X-ray can be useful. You want to rule out like bone spur. But if you want to see the soft tissues, ultrasound's a great tool for that. Now, this has been something that people throw all kinds of treatments at. If you ask 10 people, you will get 10 different answers on how to treat plantar fasciitis. They say that conservative treatment for this, which would be like reduced activity, reduced loading, icing, stretching, use of orthotics or special shoes, taping and bracing. I mean, all that can be done. It's typically over a 6 to 12 month process, though.
That's long.
That is long. That is long. Sorry. So that length of time, if we're not talking about just an acute inflammatory process, why is it that long? Well, it's these tissue changes we just talked about that are really the factor here. They say that improvements are often not seen before 6 weeks of therapy.
Wow.
So that's a month and a half of dealing with the same pain that you started with, even with therapy being done. So they say that even in some resistant cases, you've got to have some more invasive treatments like corticosteroid injections, which have risk of rupturing the plantar fascia, or radiation, which damages the tissue further, or platelet-rich plasma injections, which are regenerative, are helpful, but are not really fun to experience. It's not a real fun process. Or surgery, which can be useful, but again, a lot of downsides. The only one of those that they talk about that really doesn't have downsides other than injection pain is platelet-rich plasma, PRP injection, which can be really good, but again, is expensive and it's invasive.
Right.
Yeah. Right. So that's why we have studies like this one on laser therapy for plantar fasciitis. And laser therapy is using very safe, non-invasive light, of course, to stimulate a regenerative change in the tissues you're treating, as well as reduce the pain levels directly. We're not talking about burning or cutting. We're not talking laser surgery here, even with high-power laser. So this study was put together to evaluate usual care, basically home exercises, versus usual care plus laser.
Okay.
So let's talk about the study itself. So they had 114 participants. Their control group in this case was people that went home and did 6 weeks of exercises.
Versus the ones who did not do exercises.
No, actually. So everybody in this study had the exercises.
Just part only did them at home.
Nope.
No? Oh.
Everybody was the same with the exercises.
Okay. I'm confused.
That's why I'm letting you ask those questions, because I was confused when I read this too. So good, keep doing that for me, because it is a little confusing. The way it's set up, everybody had exercises to do at home.
Okay.
All the groups. The control group only did that for 6 weeks. Okay. The two treatment groups both had laser therapy. They had 3 times a week for 3 weeks they were treated using a light force laser, which has a blend of 20% of 810 nanometer light infrared and 80% 980 nanometer infrared, continuous wave settings, delivered with a handpiece with about a 7 centimeter massage ball.
Okay.
So large massage ball. They did a group that had laser at 10 watts and a group that had laser at 25 watts. They applied the laser to the calf as well as the bottom of the foot and the heel. Right? But all these people were supposed to do the home exercises too.
Okay.
So now, let's talk about some problems, because there are some issues with the way this is set up.
I lost the control group.
Yeah, you know what? It's actually not a control group.
Okay.
That's why you're having trouble following it. That's why I had trouble following it too. They call it a control group, but unfortunately in this study, everybody had the control treatment, and there was no control or placebo for laser.
The only difference I heard was the difference in wattage.
Yes.
Okay.
Yes.
So there was one difference.
There was a difference between, so basically 3 groups. One did just home exercises, one had 10-watt laser and home exercises, and another one had 25-watt laser and home exercises.
Okay.
So there's no placebo laser with this control group.
Okay.
Also, there was no blinding. Obviously, patients knew they weren't getting laser if they weren't getting laser.
Right.
And everybody knew, the clinicians knew it was an open label study.
Interesting. Interesting.
Also, the way this was delivered, the light force laser that they used in this case has a massage ball on the handpiece, which means you're physically rubbing it onto those tissues.
Which is one of the things people say do when you have plantar fasciitis.
Absolutely.
Is kind of rub. I mean, I think of a tennis ball. You know,
Yes,
you're massaging your plantar with the tennis ball.
exactly.
So,
So that means that our laser therapy groups not only had laser that had no placebo, they also had massage or soft tissue mobilization that had no placebo either.
right.
So
Totally aware.
yeah, I mean, in this case, I've got to say they call it a controlled study. I think it was really, really poorly controlled. So we're going to have to be careful how we interpret the results here. At the same time, I'm not saying it's a bad study. I'm just saying we need to be aware of things like this when we're looking at these studies. Because it's not always a simple, is laser good or not? There's a lot more going on here. And in this case, it's not a very well-controlled study. We could have at least had them do the massage ball portion for the folks that were in the control group.
Right.
And that would have at least controlled for the massage as a factor here. But we have to realize this is not a very well-controlled study, and there's definitely some placebo effect that we have to be aware of being a possible factor here. So let's talk about the actual differences, though, that we do have, and let's pull what we can from this study, because it's not a bad study. There's no bad studies.
No.
We just need to be honest about what we can really learn from them. So realize that laser therapy, when it's delivered, is measured in joules. Joules is our energy unit, and you deliver 1 joule per second with a 1 watt laser. Okay, so just straight up across the board, doesn't matter. We're not talking about wavelength differences, power differences, just 1 watt laser, 1 joule for 1 second. So they did a total of 10 joules for every square centimeter of tissue that they treated. And again, they treated the calf, they treated the bottom of the foot. Total of 10 joules. But one group had it delivered at 10 watts of power, which is 10 joules per second, right? And the other group had it delivered faster and more intense at 25 watts, so 25 joules per second. Okay? Total power, though, was the same. Total of 10 joules per centimeter squared. So really the difference here was that the 10 watt group had a slower treatment and less intensity.
Okay.
The 25 watt group had a faster treatment and higher intensity, but the total
Same
energy.
energy.
Yes, exactly.
Yeah.
Yep. This took me a little while to unwind too. It was a little bit confusing on the presentation as well. But really what I think they're trying to go for here is, does it make a difference if we do it low and slow versus fast and high? Right? High intensity, fast treatment versus same level of energy but slower. Right? Is there an advantage essentially to a higher power laser therapy device versus the lower power devices?
Well, just off the top, quicker treatment. It takes less time.
Right?
You can treat more people who need the help.
Exactly.
Their time is important.
Yes.
So
Get patients in, get patients out quickly. I mean, nobody wants to go sit around for
Right.
an hour-long treatment if it could be done in 5 minutes, right? And in this case, it's not a huge difference. You're probably talking about a 3 times faster treatment with a 25 watt laser versus a 10 watt laser. But the question that we can answer here is, which one is better? Which one gives more pain relief? So let's go to the findings. Excuse me for 1 second. I'm going to show you the graphs just because these are really clear. One of the things the study did well was putting these into a graphic format that is pretty obvious. If I can operate a mouse, that would help. There we go. So this is the long-term follow-up right here. So initially they had very, very good rapid pain relief with both the 10 watt and the 25 watt groups. And that continued out to the 25 week mark where people continued to generally get better. That's pretty exciting, I think. And both groups are essentially the same. Now, the short-term results make it a little bit more obvious that in comparison to their control, which again isn't really a control, but certainly the people who got laser did better, faster. But looking at the 10 watt and the 25 watt group together, they're really about the same.
Right.
So I'd like that to be our kind of takeaway for this particular study, is that they're both laser groups got good benefits, and there was almost no change.
But the benefit
between the two.
was getting laser versus not.
Right.
Yeah.
Getting it versus not. Or maybe the massage type thing had a role to play there, you know, so it's hard to say, but essentially we can say that it doesn't really matter if you have a 10-watt laser or a 25-watt laser in this case, in this particular case, unless you just wanted to be doing a faster treatment. Now, there's going to be arguments on what about, you know, different wavelengths, what about the size, the spot size of the laser, what about getting rid of that massage ball versus not, you know, but if you're using this type of device with this blend, this 80-20 blend of wavelengths, in this case, you'll get the same results probably from a 10-watt laser, a 10-watt laser as you will a 25-watt laser. So, do you want it to be a faster treatment or not? That'll be the question that you'll have to answer if you're looking at this type of laser.
I'm thinking too, if you get the massage, you know, that feels good.
It does feel
I'm
good.
just throwing that
It
out
really
there.
does. And we know from a lot of other studies that manual therapy does work well for people with this plantar foot pain. So, unfortunately, we can't learn a whole lot from this study other than if you want a laser of this type, you can get good results with the lower powered version and the higher powered version. Now, both of these lasers that were used, though, are class 4 high intensity devices. One of them just outputs a lot more than the other one. So this is not a comparison of class 3 to class 4. This is just an inter-class 4 device comparison, essentially. I do want to bring out one other thing that I wish other studies would do, and that is they talked about the Fitzpatrick scale, the skin color of the patients. And in this case, they said, look, findings for pain outcomes were not significant between the Fitzpatrick categories. I would love to see more assessment of that because darker skin patients can sometimes respond differently than lighter skin patients because of the type of light that's being used. It may not penetrate as well. It may produce more heat.
Right.
So I'd like to see that more. So kudos to the researchers that did this study for pulling out some good stuff. I would say I'd love to see this done again with a better control
Yes.
because I think that'd be good. I'd also like to see it done with some different laser units, maybe in comparison too. But overall, it's a win for laser, probably. And if you want to do faster treatments, it's not going to slow down the patient's pain relief. If you don't want to do, you know, pay extra for the higher power laser, you're still going to get good results.
Yes.
Did that make sense?
Yeah, finally. It's like, wait, what?
Yes.
But yeah.
Yes.
Bottom line, it is helpful.
It is helpful. It appears to be helpful even on the long-term follow-up. And there's nothing wrong with a little bit of massage. It feels good too.
Right.
Thanks for joining us. If you have questions or comments on this particular type of treatment or the equipment that they used or the strategy behind treating like the calf and the foot, please go to our website, lasertherapyinstitute.org. You'll find a lot more very free, very accessible resources that will be helpful for you if you're using laser in practice. If you want to talk with us, you can. Shoot me an email, info@lasertherapyinstitute.org. If you're looking for specific protocols that work extremely well, that is something else that we can set you up with as a clinician. So let us know what we can do for you. In the meantime, happy lasering.
Happy lasering.